The amount of pain I was in, I didn't realize how extreme, because you never really see yourself. But I had my friends who told me how I walked, and they couldn't believe how I moved, and they felt so bad for me because I just looked like I was in a lot of pain. And I realized that my quality of life has just diminished, and it greatly needed to change because I wanted it back. Because when you're healthy, you think you can conquer the world. But once you've got that, factor where you don't have your health, you don't have everything.
Patients have been concerned for quite some time about lengthy wait lists for surgery, and particularly for hip and knee replacement surgery. That some patients prior to 2006, 2007 were waiting a year or more than a year in some situations. And Toronto Central Lynn wanted to do something more about access to the orthopedic surgeon. How long does it take from the time, if you're a patient, you see your family doctor, till you actually get in to see the orthopedic surgeon?
So when we looked at how to look after people better, there were several things that we needed to look at, and one of them was access to care. Access to care doesn't mean access to surgery necessarily. There's a lot of emphasis on what we call wait to, the wait time from consultation to surgery date. But that isn't the only access to care that's important for people with arthritis. So when we looked at developing a new model of care, we looked at how we could help people with hip and knee arthritis to receive appropriate care in a timely manner by the appropriate provider. And that doesn't necessarily mean the appropriate surgeon. It means the appropriate provider. So we wanted people to have access to both surgical and non-surgical care in a timely way. And we also wanted people to have some choice in terms of how they receive that care.
So one of the first things we had to do was increase capacity in the system. The system was just overburdened. Surgeons really were having a difficult time seeing additional new patients in clinic. Patients we knew were frustrated with clinics and with wait times in clinics. So we listened to patients, and one of the first things we did was we introduced physiotherapists into the post-operative outpatient surgical clinics. And then through a 3-month training program, we were able to then expand the role and have the physiotherapists see patients in the assessment center, so as an initial visit to the Holland Center. So patients are now seen by advanced practice physiotherapists who perform a comprehensive physical examination, do the necessary diagnostic tests, and then talk with the patient about whether or not they need surgery, whether or not they want surgery. And I really think that it's that conversation with the patient, that's where we add value.
Osteoarthritis was something I've been living with. I got in touch with the Holland Center, asked for an appointment, wanted to follow up on the x-ray, and was seen in very quick time. I was impressed by that. My sense there is that I was being seen by a team, and at this point the lead on the team was the advanced practice physio, but the backups to the team was the front office, was the receptionist, was the person scheduling, was the medical clerk, and sitting just in the background were the physicians on a need-to-know basis. And so I had a sense of dealing with a real high-performing team. It was very impressive.
Now when patients come for consultation, they've been through the assessment center. So we can review what the advanced practice physiotherapist has found on physical exam. If they've seen the nurse, we know what their general health condition is like, so we know if there are any barriers to their surgery. But the main issue is that I can spend more of my time, and we can all spend more of our time, discussing with the patient the surgery, informing them of the risks and benefits of the surgery, what their rehab and convalescence will be like. So it allows us to use our time more efficiently to communicate the important things to the patient relative to their surgical experience.
By introducing an electronic referral tracking system, we now have a way of collecting important information about each step of the patient's referral through the system. Prior to this, it really was a black hole. Referrals were sent into individual surgeon offices, and there was no information provided back to family physicians as to when that referral was received and what was happening with that referral. Now we have a very coordinated system, and that coordinated system also provides patients with the option of selecting the next available surgeon or going with a surgeon that has a longer wait time, and then patients can make that choice.
But the patients are very happy with the team approach. They see that they have multiple caregivers that can answer specific questions for them relative to the area of expertise of the care provider. So that they know the surgeon can answer certain things, but the advanced practice physio can answer different things or provide them with different assistance. The same with the occupational therapist as needed. So we have a team approach now that the patients see as very helpful to them in terms of accessing the appropriate information.
They were seamless with me, and the handoff to the surgeon for my consult was timely, effective. I didn't have to repeat a whole whack of information, and again, just an elegant, seamless experience. It's given me great optimism. I haven't had the surgery yet. I have a date this summer for it, and I'm actually looking forward to it.
So much of what we accomplish around Sunnybrook is based on teamwork. And this new model of care is just a great example of Sunnybrook teams coming together to improve the quality of care. Now, there's a number of benefits of this initiative. Clearly, this has improved access, but most importantly, the patients appreciate this. They really notice what a difference it makes. This is just a great example of Sunnybrook's innovation, and for us, what it means to be there when it matters most.